Hi there, good morning. My name's Dr. Sarah Dybel. I'm a clinical lecturer at the University of Manchester, and I'm joined today with colleagues from EMUnet, as well as Professor George Schett from the University of Erlangen and Dr. Alessia Alunno, who's joined from the University of EULAR. So I'd just like to introduce, we're EMUnet, we're young rheumatologists, and this is a subsection of EULAR. Today we had our Mentor-Mentee Meetings, where there were 15 young rheumatologists who were joined by our professors to ask about what career advice and how best to position ourselves in our future careers. So I'm going to pass you over to my EMUnet colleagues who are going to ask some questions to our professors today.
Yeah, hello, so my name is Morten Agard. I'm a postdoctoral fellow at Aarhus University Hospital. A pleasure to be involved in this initiative. And I would like to ask a question to you guys. So why prioritize the time to be in a program like this, a mentor-mentee meeting? So what motivated you to join this activity?
Well, in my case, actually, I was so enthusiastic to be here because in 2016 I attended as a mentee, and it was really a game changer in my career. So being mentioned to be a mentor now was truly rewarding, and certainly I was fully committed to dedicate my time to that.
Have you something to add, Professor George?
Yes, I really very much enjoy to talk with young people and also particularly about their career development, which is important. And I think this setup actually was a very nice way to interact and to answer some questions and to discuss about how to integrate science and clinics, right? Because that was an important topic in the discussion, and I really enjoyed these discussions. And discussing the opportunities, what is possible in the future and what is feasible. I think this was very important, and I really enjoyed this time with you.
Thanks a lot, Jens.
Okay, I just introduced myself. My name is Cathy Melon. I come from Cameroon, and I'm a rheumatologist working in Kenya. I will ask the second question first to Professor George. I want to ask you, what is the most advice that you can give to the new doctor who start research? What is the skill that you need to have?
Yeah, I think that my advice is to acquire specific skills early, right, in the education, because it is important that you can use them later to develop your science, right? When you are in the midst of education and in the residency and fellowship, you have a lot of patient exposure and you don't have often enough time to learn new skills. So that's why to acquire them early and to go with already some scientific skills in your education is very helpful. I did this, for instance, and I think it brought me to science and let me stay in science. So I think that's something what I want to, and I advised actually the fellows I met today.
Thank you so much. Have you something to add, Dr. Alex?
I totally agree with what has been said, and I think that the key word in early phases exactly is exploring and finding different skills and building your career step by step, and most importantly to find a mentor to guide you, because you can gather whatever skills you may wish, but then if you're not guided and find your own path, then the skills may not be as useful as they could be. So certainly early career skills and a mentor.
Okay, thank you so much for the time that you have taken, for the experience that you have shared for us. We have learned a lot, and we hope that in the few years we will be in the position to be a mentor to another mentee. Thank you so much.
Thank you very much.